Hello, everyone. This is Eric Glazer, and welcome back to Bright Spots in Healthcare, produced by Bright Spots Ventures. Our mission is simple. It's to spotlight what's working in healthcare and help scale it. We bring together leaders from plans, hospitals, and other healthcare organizations around the world to share proven strategies that drive measurable impact. And through our podcast, our private executive councils, our private events, and our go-to-market strategy work, we surface and amplify the bright spots in healthcare. See that pun I just made? Proven innovations others can learn from and replicate. And why do we do this? Because we firmly believe the best way to improve healthcare is to find what's working, to find those bright spots and clone them. If you have not yet subscribed to this show, stop what you're doing right now. Click on your favorite podcast app, look us up, and please subscribe. You get access to all of the great insights from the leaders that we're privileged to have on our show, like the ones you see if you're watching on Zoom right now, before you today. Speaking of today, our partner in crime and our sponsor is League. They're the leading healthcare consumer experience platform, reaching more than 40 million people around the world and delivering the highest level of personalization in our industry. Payers, providers, and consumer health partners build on League's platform to deliver high engagement healthcare solutions proven to improve outcomes. You can check them out at league.com. I will vouch for them. They're one of the smartest organizations I've had the pleasure of collaborating with. And along those lines, our topic today is closing the member engagement gap with AI-powered actions. Now, I'm going to introduce each one of our guests. We've got 4 of them today. When we bring them on with a question, we'll also put their bios in the show notes and in the chat if you're watching on Zoom. And we're going to get into it because for every member like me who logs into a portal, there are 10 of us who don't take that next step. They don't schedule the preventative visit. They don't join the care program. They don't follow through on the referral. And that gap between access and action is one of the biggest obstacles we have in our industry. I told you at Bright Spots, we believe the key is to not focus on what's broken, but look at what's working, those bright spots. Across the industry, I could assure you there are bright spots where AI is moving the needle, not just pushing out more messages, but creating precision engagement. AI is helping organizations identify who's most likely to act like me and who needs a different kind of support, and how to deliver those in different ways that actually change behavior. So today we're going to divide up our hour into 3 segments: AI in action, and how we remove barriers around AI, and then AI as a foundation to your entire engagement strategy. And we're going to share with you all kinds of bright spots. So let's get started with AI in action. And we'll kick things off by looking at one of those bright spots in action at a little-known organization out of Pittsburgh, Pennsylvania called Highmark. They've been using AI to tailor engagement on a very individual level. So Ian Blunt is their VP of Advanced Analytics. Ian, welcome to Bright Spots. And if you can, just take us through a concrete example of how this works over there, and maybe even one of the surprises that in terms of who engaged and who didn't as you look back at the program.
So glad to be talking to you today. So Highmark's Living Health approach uses AI across everything we're doing in the way we support our members' care journeys out there. So for example, we're using it to try and better understand the needs at a population level so we can bolster our portfolio of health solutions that we provide to people. We're using near-time data and predictive models to identify individual members' needs and then match that to the most appropriate support for that member. Critically, of course, we're using it as we get that message out there to the person who needs to hear it, whether it's the member themselves or their provider or some other part of their care team. And interestingly, we also use AI to help understand the effectiveness of those solutions as well. So I'll give you one example, our virtual joint health solution. Obviously, we bring it in, it's in the benefit book. Any member who has that benefit could opt in, but we go a bit further. So we're constantly looking for when the activity we see around a member suggests some pattern that reflects they're having joint issues. and then outreach with a message, encouraging them to use the program. We've got nearly 60,000 members have used it so far. And I mentioned that evaluation. We're looking at all of those members' progress in the solution and using mixed methods, quintuple aim evaluations. So from talking to those members, we see 92% are actively engaged in the solution. It's got a net promoter score of plus 18. 69% of reporting pain reduction, so improvement in outcomes. And we also, as I mentioned, use some of those AI style techniques to look at other members who started in a similar place but haven't opted into the solution. And from that, we can see that the members that do take advantage of virtual joint health, saving statistically significant $112 per member per month over 12 months. And that's coming from reduced use of the emergency room, reduced surgery, reduced imaging, compared to those members who have similar issues but aren't taking advantage of that digital solution. And because of all of that, we're able to take the step and expand that to all fully insured members as of the start of 2024.
Okay, so we're taking an AI-enabled, we'll call it, can I call it a PT program? You called it virtual joint, right?
Yep.
Okay. At first, I'm like joint health. What? I don't know if people thought it was like a joint program or someone else. So, okay, so it's a virtual PT program, and we're seeing you've done studies at 6 and 12 months to see sort of the impact you're making on each particular member. Now you're moving into FI.
So that happened all in 23, and we were able to open it up from 24 onwards to all members. And we really believe in that kind of virtuous circle of understanding the effectiveness of these solutions for the individual members, and then where we've got solutions that are effective, scaling them further into the business. And if we've got solutions that maybe aren't meeting our expectations, how can we use some of those evaluative and predictive model AI techniques to understand how we better target more appropriate members and how we improve the solution?
Got it. And just to go off the cuff real quick, you enable, like, you've all different kinds of digital and virtual services that you're trying to individualize for each member, all different probably strategic partners and vendors that you're working with. How are you able to like put it on one stack? How are you able to make that experience seamless for an individual member with this specific individualized benefit design? How does that all work, and how are you able to do that and combine that with everything you just mentioned for the virtual joint program?
So the kind of next best action engine that underpins this whole system is very important to us as an organization. I think one thing you often see in payers is they've gone and collected various vendor solutions. They might have internal programs at all as well, but they don't connect those things. So one very classic complaint that members have is they get multiple outreaches for different things that aren't connected, and it's very frustrating, disempowering, and reduces engagement. So a step we took at Highmark pretty early on in my time here was to think about, we need to route all of those intervention kind of opportunities through a centralized system that can stack rank what's the best next action to take with that member. And that's based on the relative value of that intervention, both to the member and to Highmark, as I mentioned. We've got a really good understanding of the order that we should be deploying them in, and the capacity that we've got to deploy each of those interventions. That allows us to optimize the whole system. So we're making the most effective use of our intervention resources, which is, of course, we're keeping the administrative cost burden down. And also, we're not confusing the member with duplicate outreach as well. So in that way, it's much more targeted to their immediate needs, and really helps them give a very clear call to action to go engage. And I think one of the things that's really exciting, particularly with the rise of large language models, is how we can now take that next step into tailoring that outreach to individual members. So we're already able to do your classic marketing thing, target different messaging to different personas. So the messaging will resonate with the member that it's aimed at. I think the potential of large language models to go even deeper in that is going to be very exciting to see it be used and developed over the next couple of years.
Great. I'm going to come back. We're going to dive in a little bit more to how you get all that done and some of the other experiences you guys are having success in with AI. I'm going to bring on our next guest. That is Dr. Charles DeShazer. He is the former Chief Quality Officer at the Cigna Group, and Dr. DeShazer also used to work at Google and at the aforementioned Highmark. And so, Charles, can you talk about an example of how AI-enabled personalized interventions work at scale, and what are some of maybe the most important lessons you've taken from all your experiences?
Absolutely. Thank you, Eric. I wanted to start by just emphasizing that the holy grail of healthcare is engagement, because without it, the triple aim is not achievable. To the extent that members are engaged, they become more activated, and activated patients have lower costs, higher quality, and better experience. In other words, activation drives achievement of the triple aim. And the issue is that there are two major challenges in terms of improving member engagement. One is that members are disengaged because they're confused. Our system is extremely complex, fragmented, benefits are complex, and navigation of networks and resources is confusing. The other reason is that there's poor personalization. And this has been my experience as a clinician practicing at Cook County Hospital in the inner city. You have to consider context, because generic recommendations don't recognize context, fall on deaf ears. And so the opportunity is that health plans have tons of data, typically more comprehensive data than any other healthcare stakeholder. The barrier has traditionally been interoperability, making this data actionable, and then frankly, the people needed to execute on these data. So advanced AI presents a tool that solves multiple hard problems we've struggled with for decades. Because of the ability to process natural language, to see and hear, called multimodal capabilities, and to reason over tons of data in seconds at scale, we finally have a tool that can transform healthcare. This has never existed before. So in a couple examples, from a clinician standpoint, I first became aware of the immense value of this capability at Google, where we leveraged Gen AI for our Care Studio product. Google promoted standards like FHIR, and we recognized to the extent we can organize information in standard formats and then apply these AI tools, we were able to translate huge amounts of complex clinical data into actionable data in seconds. And we call this clinical sense making, basically taking overwhelming data and turning it into clear, role-specific insights. But here's the thing that I think is really important and why AI is now transformative in terms of a tool. What we discovered is that the early large language models, we could not overload the reasoning engine. So in other words, we poured more and more data into the tool, and it got better and more precise. So typically in healthcare and technology, you think about load balancing and things getting overwhelmed from that standpoint. LLMs get better with more data and more precision. And so we exposed clinicians to this, and they were blown away. You could have a primary care view of data, then a cardiologist view of the data, organized in a way that made the clinical assessment and next best actions clear, and at a level of sophistication that was value added for physicians. Now, when you look at that from a health plan perspective, again, the ability to organize this wealth of data that health plans typically collect and provide navigation and context for members is a huge opportunity. And another example is Cigna's just released their AI-driven virtual assistant for members. And it's a conversational AI providing answers through around benefit coverage, claims, and care options. And the key thing is that because you don't have to pre-program the responses, it's very flexible and personalized, and it's conversational. Early results are very positive. 67% of customers are using it. And Eric, you mentioned the lack of uptake for portals, for example. Folks are very attracted to these tools, and 80% reported it as being helpful. So I would say the key lessons learned, number one, the highest value use case for AI is summarization and explanation, because there's less risk of hallucinations, we've heard that term, and activating bias perspective. And this fits perfectly with one of the greatest challenges we've always had in healthcare, which is making sense out of the tons of data that we collect. And this also enables providing context and personalization at a very, again, you alluded to it, at a precision level, at a level of precision that's not possible any other way. I want to add the standards are less critical with AI, but they are very helpful because you have to reduce variation and the need for and risk of interpretation that the LLMs would provide. So this helps in integrating as well with external entities. The last point I would say is that AI governance is probably the most critical element. This is new technology. It's more sophisticated than anything we've used in the past. And we have to be aware of the downsides and risks and monitor closely for unintended consequences. The other point is that the lack of clear regulations means that individual organizations will now have to be more accountable for the responsible use of AI. So AI's best first use case is sense making and explanation. Standards matter, but AI can fill gaps. And governance is essential for trust and safety.
And let me just quickly try to summarize all that, because you said a lot of really good things, and I want to make sure I captured it. So my takeaway on all this is, don't be afraid of AI, lean into it, and demonstrate to your physicians how important it is, because they'll become believers, should become believers. But to summarize, just to really summarize everything you just said so brilliantly, was the highest value of AI today is summarization and simplification. I'm not sure, I'm paraphrasing a bit, but that's both for clinicians, where you're taking complex data, turning it into action, making, I think you used the word clinical sense, and allowing that reasoning engine to be enabled. The reasoning engine gets better and better through the LLM. And then also you use the example on a consumer side with individualized explanations of benefits and benefit design, personalized for members. So that's right there, two examples of simplification in action. And then you close things out saying, standards do matter, but they're less critical with AI, because AI reduces variation and reduces issues around interruption and standards. And then, of course, AI self-governance is critical.
Absolutely.
Good stuff. I want to, let's bring in some of our, I guess you're at Google, so I shouldn't say you're not a tech guy, or you used to be at Google. I want to bring in Andrew Duboak. He's the Chief Growth Officer at League. Andrew, organizations are investing in digital tools, yet they're struggling to turn that into meaningful action, like I said on the onset. What does it take to bridge the gap? Like, what are some examples, maybe if you could provide, of any kind of healthcare organization that's starting now to get it right and starting to do some of the things that Dr. DeShazer just outlined, and some of the things that we've heard from Ian?
Great question, Eric. And actually, I would just put that in the background of, we're in the middle of what I'm starting to think of as the Dr. ChatGPT moment. So if we've lived through the Dr. Google era of the last decade, where Google became a top destination for healthcare consumers to get information on healthcare, to find care, to connect with patients that were like them, Dr. ChatGPT and the announcements that the team at OpenAI have made in the last number of weeks about leaning into healthcare as a core use case for ChatGPT, I really think is a seminal moment for what the future consumer experience in healthcare will look like. And the pace at which it's changing is far faster than probably any of us sitting around the table today are moving. And so it really creates a new kind of urgency for thinking about, to Dr. DeShazer's point, how to leverage this incredible technology, how to turn that technology from, kind of base level insights into really personalized care, and then ultimately meet people where they are, because The thing that Dr. ChatGPT doesn't have today, in my view, is it doesn't really have a deep understanding of you, at least yet. It's not necessarily as clinically valid or as trustworthy as your family doctor, as a specialist physician, and it doesn't take action, at least yet. And so when we put those things together, I think it leads to an answer to your question, Eric, which is around your question for, well, how are organizations starting to use AI to change behavior, to get people to take action when they have been unengaged? And I actually think a number of the folks that we have today are great examples of that. If I think about the work that Michael and team are doing at Ovation, they're getting really focused on specific use cases that Michael will tell us more about, where they want to deliver care in a very targeted, virtual first way. And the fact that they're focusing by they're picking a use case, they're picking a condition area, allows them to get really personalized in the journeys that they want to take their patients through. And I think one of the challenges what we've seen in healthcare is we've been frankly too broad in applying a lot of this digital technology. We've been trying to create products and experiences that are one size fits all, as opposed to, again, getting really focused on a specific need that a patient or a member has. If I think of some of the examples that Ian talked about around the work they're doing in MSK Health, or the work that League is doing with them as an example broadly, and kind of evolving their digital channel as kind of part of the chassis for how to merchandise the right programs at the right time. One of my personal big insights from the work that League and Highmark and Google have been doing together as examples has really been around, we can get meaningfully higher engagement, get people to take meaningfully higher action, and get more people enrolled in programs when we merchandise those programs in the right way. That means to me, we're focusing on the use case. So as one example I was thinking about was, we've seen a 5x increase in adoption of a mental health program that Highmark Health provides its members. And that's really all through really thoughtful design on the entire journey for how do we identify people that might be relevant for this program? How do we start to position content even before they might be the person that needs that content or that program at that time? And then again, how do we start to walk them through easy next best actions for them that allow them to get access to the right resource and see the value in these programs for them in a time of need? I'll pause there.
No, I love that. And it's basically allowing healthcare to go where the puck's going to be. Nice little quote, little Wayne Gretzky there for everyone who didn't get that. So I want to, I want to bring in, Michael to expand upon this. Michael Dalton, who Andrew just introduced, CEO of Ovatient. So Andrew, very quickly, just a quick little 15 seconds on Ovatient so everyone has context. And then how do you see AI helping plans and providers build virtual care strategies? Like we heard from Dr. DeShazer, what's going on with the complex medical information, but like how do you see that working around access and experience and just expanding provider capacity? And what does that look like in practice?
Sure. So for many of you on the call are probably or in the webinar are not aware of who Ovation is. We're a virtual first multi-specialty practice. We partner primarily with health systems because we're built on Epic. And when I heard Charles talk about interoperability and also some of the movement, and this is, for League, we're a partner with them because of the work that they're doing with health plans primarily, but also there's an opportunity with where Epic's going with their payer platform and sharing that data across both payer and provider for the benefit of the patient. And so for us, we really, and as it tees it up perfectly, is I like to start from a simple premise. There is no wrong door for a patient to walk through, as long as it does not lead to a dead end. We start from a simple premise for Ovation is we do not want to create a dead end. So the premise that we have here, though, is the patient owns the relationship, not a provider, not a plan. And oftentimes when I talk to providers, this can seem controversial because they feel like they own that member, they own that patient. But patients increasingly have choice. And to Andrew's point, we've gone beyond Dr. Google. And what we really want to be able to do is that with that no wrong door, and you hear this notion of a digital front door, we want to create a digital health home for patients. We want to be able to help when that patient has a question that we're helping them navigate to the next best action. And that's where AI earns trust. And it earns trust both with patients and the provider, and with the clinical team. So it provides clear guidance and understanding for patients, and then it removes inefficiencies. It's going to make for a more productive, high-value conversation and engagement between provider and patient. And I think what's really, really important is, as we're talking to our providers, so we have over 40 providers. We're a virtual practice. They're fully employed by Ovatient, and we do this on behalf of our customers, Metro Health and the Medical University of South Carolina. We are preserving clinical judgment, and we're also creating patient choice. We're not taking those options away. So, and that's this notion for us is that with our AI capabilities, we can honor our promise that we can be virtual first, and then understand how do we keep that care local always. So patients can start anywhere. They can be on the web. They can be an app. They still might want to call their call center. And we're going to get them to the right place at the right time for the right care that they need. And also, when they start virtual first, we can get them connected to in-person care when needed. And that comes with the interoperability that Charles talked about, being able to advance that patient across their care journey and be able to provide them with that every step of the way. So because we're built on Epic, we're also able to use connected data and have connected workflows across that patient journey, and make sure that the information follows the patient. And that can include orders, results, notes, referrals. I like to say, so handoffs, they don't break continuity. They actually have an opportunity to build trust. They can delight the patient. And too often you hear that, something got lost in that care transition. Really what we're able to do, both with League and then also with, being on Epic, we're building trust in that. I would say too that I would hope to see that over time that we are going to see that, payers and our health system customers are going to reward continuity and not episodic care. And so I think really enabling some of this technology, putting this in place, we can see those closed loop referrals or that patient demonstrating and taking action and being engaged in their care. We do have a digitally native patients that they're automatically going to be here. What we need is to get kind of that middle level. There's some that are never going to engage. What we really need to move is those patients who are on that precipice, or we understand how to better engage that patient and then move them over to get them involved in their healthcare.
Go ahead. I was going to say, so the no wrong door I love, and I love giving the patient agency, but enabling the provider works a lot, and that's going to improve not only engagement or enablement. I like saying enablement over engagement. And I don't want to be engaged. Don't engage me, but enable me. Now we're allowing the patient to have agency, doctor to have scale, and the whole thing kind of gets back, even though we're using a computer, it sort of gets back to a physician's roots of carrying a black bag to a patient's home. I like that a lot. You talked about what did you call it? Remarkable experience. What was your adjective that you?
Delightful
experience. Yeah. So I'm going to dovetail on that. We've been working hard for these live shows, for you live guests, also for you listening on the podcast, to just improve the experience. So we're going to do one of the things we're going to do as a byproduct is anyone attending today, we will not only take my notes that I'm taking, and we're going to combine them with the transcript of today, and we're going to create a key insights document for everyone. So for attending, we're going to send that to you as a PDF. As a favor, though, I would love if you could provide us more feedback. So in about 10, 15 minutes, I'll send you another email just asking for your feedback so we could get even better at this and provide a more delightful experience for all of you moving forward, besides just having these great guests. And to that end, one of the feedback pieces we've received is if we register every week, it's a pain in the neck. So we're trying to register you folks ahead of time. So we have 2 upcoming events. One is next week on the forecasting frontier, and we're going to talk about how AI is reshaping risk, revenue, and ROI, and really thinking about underwriting, rate adjustments, sales, and using AI in a much more commercial and total cost of care prediction model. And we have Blue Cross Blue Shield of Florida, Independent, Primera, Blue Shield of California. It's going to be a great group. So we'll register you for that if you want. And then we're going to have a session a couple weeks later on September 11th. State still is weird. You can't even say it out loud still, but doubling down on Medicaid innovation. So we're going to really get into Medicaid. And if you're in the Medicaid space, you want to come to that. We have a great group for that event. I want to bring back Ian Blunt, Vice President of Advanced Analytics at Highmark. How, Ian, is Highmark building a more accurate and relevant understanding of each member so you really understand the member to deliver that individualized support, similar to like what Michael and Andrew were alluding to, and maybe show an example of how that led to a better coordinated impactful intervention for one of your members?
Well, so it's really about being able to access that richness of data set, but also in a very timely way. People's needs change all the time. So Highmark's established a whole set of information feeds that are continuously coming in, and we're continuously monitoring them. So I'll give you an example of a female member in her 20s from Erie, Pennsylvania, just up on the lake. And it all starts with data availability, right? So she goes to her PCP, she's pregnant, that gets confirmed. Pretty soon after that, the message comes back for interoperability that we become aware of it. And using what we know about that member's history and their current situation, we're able to predict that she's at a high likelihood of having a high-risk pregnancy. So this is someone who we think really could benefit from the help that we're able to provide around that. So it cues for telephonic outreach from a specialist nurse case manager who specializes in helping expectant mothers through these high-risk pregnancies. But we've also got more information. So we've got our My Highmark app, which is provided by League. Part of interacting with that is members fill out health risk assessment questionnaires, which has strong social determinants of health questions. We try to ask those SDOH questions at every encounter the member has with Highmark Health, whatever context that's in. And it turns out that member in the past had flagged that they've got some concerns about housing insecurity. That's really useful. We now understand more about that member. So when the specialist nurse reaches out, that nurse already knows about the housing insecurity concern and is able to use our Find Help platform to connect the member with a local community-based organization that supports housing difficulties that people might have. So I think that's a really good example of how we're trying to get information from multiple sources, bring it together, but then also use that to connect on behalf of the member all the sources of support that they have at their disposal. So thinking well beyond healthcare into some of those more social things and partnering with community-based organizations. And I think within that, there's a philosophy of making sure that we're maximizing each single encounter, very much along the idea of no wrong door. We're thinking about, we can reach out to try to engage, activate, enable members, but also members are going about their daily lives. If they're reaching into us for customer services, those customer service reps need to be able to call out some of the opportunities that member has once they've dealt with whatever the issue is. Platforms like My Highmark going direct to the member, again provided by League, really valuable tools for letting the member tell us more about them, but also then communicating with the member, and also interoperability with doctors' offices as well. So being able to really leverage the provider as part of the care team, both to support the member, but also give the provider themselves insights on how we understand that where that member's at right now and what their needs are.
Right. What I like about that is you took out the variable of human error. You listened through AI and were able to identify things and then have an actionable insight from that changed someone's life, and also in doing so, the residual value there is you help create a better business too. Really important.
Well, absolutely.
Yeah. I want to, one of the things that I think we're talking about, I'll keep on plagiarizing. I'll keep on plagiarizing Michael here with a delightful experience. Is in healthcare, we want sort of what we get, right, with a really good retail experience, maybe an online purchase or restaurant, banking, where we're just able to easily take action for our health and enable us to, have a much better experience. And I know, Andrew, that's what League is all about. That's sort of incorporated into your culture and your mission. But there's also this thing in healthcare, right care at right care for the right patient at the right point of time, and there's probably something in healthcare around sort of right technology for the right situation at the right point of time, and there's a lot of hype around AI, right? But sometimes we need a new tool or some other different approach. Can you share an example of how a healthcare organization you've worked with turned sort of messy or fragmented data into something that actually move the needle for a member or a provider?
Sure. And I'd actually point to a lot of what Ian already described as a great example of that. And then I'll maybe transition the question to something that's on my mind in terms of the forward-looking opportunity for how we use this new technology, very much also inspired by Ian. But again, if I just kind of step back and think about the work that Ian and the team have been doing at Highmark, they really started with a premise around this idea that you needed to better understand who the member was to deliver on their living health strategy, which was this idea of shifting from being a health insurance company to really helping orchestrate and coordinate care for members and patients. It's hard to do that without a good understanding of who your member, who the patient is. They've obviously made huge investments that they've spoken very publicly about with Google Cloud Platform or leveraging Epic Payer Platform, in particular with their wholly owned health system and Allegheny Health Network. And what's exciting for a company and partner like League, where we really think of ourselves as kind of the last mile of engagement, how do we take that insight and turn it into action, is that they've built this awesome foundation to start with. But to your point, Eric, I would say that across the industry and the healthcare leaders that I get the chance to work with and have gotten to know, essentially everybody's got the same problem. They actually have pretty limited insight on who customers and members are. Data is fragmented across lots of different systems. There's lots of failed data transformation programs that haven't got off the ground or have been very high investment with low return. And so on a go forward basis, and something actually that Ian even talked about a bit in the chat, there is a promise that agentic AI will actually allow us to get a much more rich and synthesized view of who a member or a patient is. And that a lot of the legacy challenges of creating that single view, this is what an agent can go do. We can have agents that actually go and operate across our disparate systems and bring together that human story of who a healthcare consumer is, of which then that agent can then take action on behalf of the healthcare consumer. And this kind of points me to a little bit to your analogy, Eric, of where the puck is going. Ian talked a lot about this kind of proactive outreach paired with reactive customer service across many different channels. And if we look at many of the organizations across healthcare and how they've organized customer experience, they've actually put it in a bunch of different silos. We've put texting over here, we've put contact center over there, we've made this digital channel team, we've got the call center doing some outbound work with care management. It's not actually all together. It's kind of like Humpty Dumpty fell apart from a customer experience point of view. The most progressive organizations that we're seeing, including Highmark, are actually putting those teams together, because that allows you not to just take the single view of a customer. It doesn't just allow you to think about the right set of technology, Eric, to your point, but it actually allows you to think about the right channel and how we can orchestrate across all of these different touch points that we have with the customer. And why that to me is so powerful in healthcare is maybe unlike other consumer industries, healthcare has the most value from proactive outreach. If we can get you to proactively take an action that you haven't taken, like closing a care gap, that's not just monetary value to the stakeholders that are on this phone call, but that's also a real impact to someone's life. We can save lives. And this is the other promise of agentic AI that I think we should be acknowledging as we go forward, which is that healthcare probably has the biggest gap between consumer demand and ability to support that demand. We have massive labor supply and constraints. Agentic AI and technology can start to fill that gap so we can actually deliver more care at scale, take the care of the people that we have and amplify them while adding new types of labor to meet the kind of insatiable demand for being well and being healthy. I'll pause there.
I love that a lot. I'm going to, at the risk of getting in trouble with you guys, there was a white paper that you guys are writing that really outlines this really well as far as just purpose-built AI from a strategic standpoint, because I got to review it. I think it's called The Strategic Shift to AI-Powered Engagement. So I would recommend everyone take a look at it. It's really a high-level way of incorporating strategy, your AI strategy into your business. And it's a pretty good, easy read if I could understand it. So I'll send that to everyone if you want after the show, and then beg league for forgiveness there. But if you want a piece of that, you should definitely, and I don't know if it's on lead.com, but certainly there's a lot of other good content at lead.com beyond that white paper that I just pitched. But you'll get everything from like what Andrew's just saying around how to think about your strategy around personalized health and the journey that AI can enable, and how to the interoperability part of it, and just the potential outcome that, when you take that fragmented data and you create an individualized experience, what that can mean using agents and some of the other tools that agentic AI and AI in general is providing all of us in healthcare and beyond.
Well, and Eric, maybe just to add, and I do think we're very much on the frontier of this technology as it applies to customer-facing or member-facing use cases. We've got some good examples of scribing technology that are helping with daily productivity for clinicians, very fast adoption in that category, as we all know. Those are really internal-looking tools. The customer-facing pieces of this puzzle are still pretty nascent. It's early days. That's why I definitely spoke to the Dr. ChatGPT moment we're going through as kind of urgency for why now to take action. But I'd also say that to your point around data, Ian talked about this as well. Lots of healthcare organizations have done immense work around using maybe old AI, which is machine learning models, rules, and logic to help do cohorting of patients, risk stratifying populations, trying to drive the next best action. But those are inherently limited because it can't actually make it all the way personalized to you, Eric, or to you, Dr. DeShazer. And that, to me, is part of the engagement gap that AI can fill. We've had this promise of digital transforming engagement. We've gotten some of the way there. My personal view is that this technology that we now have at our fingertips is what gets us all the way there, because it actually enables true personalization at massive scale, and it can intelligently adapt to you, versus before we have to have people writing copy for, well, what is the message for these 5 cohorts we have? Well, now we actually can have agentic technology make these decisions on the fly for us.
Yeah, agree with all that. And there's a lot of good stuff out there, even about just fulfilling orders now and other areas of the business where agents are doing so many things, from taking the order and getting it completely fulfilled out on the consumer market. So I think it's coming fast and furious, and healthcare should grab on it. I'm going to bring in Dr. DeShazer. Charles, when it comes to enablement and engagement during care transitions or higher risk moments, what strategies have you seen that have proven effective, and maybe some of the hurdles to embedding these approaches into workflows? Because that gets kludgy. We're getting into workflows, especially at scale. Do we have you on mute?
Charles.
Yeah, I'm sorry. I first of all, this is a very exciting discussion for me. I've been trying to drive change in healthcare for 30 years, and now it's really feasible. I mean, and I think Andrew summed it up very well. I was involved in developing a living health strategy at Highmark, and talk with Ian. It's exciting how that's coming to life. And I think this is an important question, because when you think about engagement during care transitions or these high risk moments, as Andrew alluded to, that's really the last mile of engagement. And I would say the true test of your system. It's where success or failure often determines outcomes. And so what I've seen work best are approaches that we've been talking about in terms of really personalizing the interactions. For example, collecting, this member profile, and as Ian mentioned, in particular, the social determinants of health. We know that drives 70% of the outcomes, in fact. And we model this and predict also what are the best outreach strategies and approach the interaction from a whole person perspective, considering the full context of their needs. And I'll just give a very simple example, but you can begin to think about how you can amplify this. We had a outreach campaign that had a generic email. When we changed the wording of that email to be more culturally sensitive and specific, the open rate went up 100%, and the click-through rate went up 50%. And so just think about that. If you didn't customize that simple messaging, a huge portion of your population would never even have opened it. It would not have touched them. And so when you begin to connect all those dots and combine member data with AI, you've got the opportunity to generalize highly personalized scripts and have the RN or case manager connect with the individual as an individual in a holistic way that makes it very relevant and supportive, and they will be more engaged. They will be more enabled. The challenge, which you've alluded to, Eric, is embedding these approaches into workflows at scale. And so case managers are typically, I know health plans I've been in, working with claims systems, case management systems, Epic, et cetera. All these systems speak different languages. So what we need is a layer of standardization, and Michael mentioned this as well, through which frameworks like FHIR or common terminology, such that AI can sit on top and translate and connect some of the dots with the system. Once you have that, you can then layer in the intelligence that AI can generate, this personalization and prompts and the metadata that makes the workflow more effective and accessible. And then again, as Andrew mentioned, what I'm really excited about as well is agentic AI, because now you can begin to have the technology that's the super intelligence begin to take action. And so it's not just about deploying AI, it's about making it interoperable, explainable, and truly fitting within the daily workflow of clinicians and case managers in a way that makes their work more enjoyable. Because I've led payer, provider, and tech organizations, and the lesson for me is clear that AI's power is only realized when it enhances the human side of healthcare. And as a physician, that's what I'm excited about. Let the AI do all the administrative work, connecting the dots, et cetera. Let me do what I enjoy most, which is that human side of delivering care. So I think that we've got a very important opportunity here to really connect the dots in a way that's, again, it's going to be transformative.
Good stuff. There's another podcast. It's called ACQ2. It's part of the Acquired brand. If you listen to the podcast Acquired, and there's an episode called "How is AI different than other technology waves?" Just a couple of days ago, it dropped. I'd recommend everyone listen to that. It covers a lot of cool stuff around this. Andrew, when it comes to digital transformation, healthcare organizations are sort of still debating whether to build it or buy it. And so how should folks listening be thinking about platform strategy today, and what questions should they be asking to make the right long-term decision? Because it's a big call they have to make, and maybe provide examples of organizations' decision-making processes that you've been exposed to, and maybe one that's built it and one that's bought it. And we'll also invite, while you're answering that, we're going to put up another poll for a private event we have upcoming, but I won't even take time because we're running late to explain that event. We'll just put it up in the poll. But Andrew, go ahead.
Quick thought would be that build versus buy is probably the wrong dichotomy. It's really about where to partner and with whom. If you think about the surface area that we have in this kind of new world that we're going into that is taking advantage of this new agentic AI technology, there's so much ground to cover. There's so many pieces of the puzzle that have to work together for this to get it right and to have the real benefit. And so I just go back to it. It's really about where to partner and with who. And this does feel like a watershed moment where you think about the promise of delivering better care and better health has to connect back to interoperability. And that's not just interoperability of data, but that's interoperability across how care is delivered. We actually can use this moment as a way to connect many disparate organizations that deliver care and who pay for care to support people through a very complicated journey. And so when I go back to the point about it's really about where to partner, I think that is just the unique question of what is the secret sauce of your organization? What do you want to uniquely do better than everyone else? And then how can you find partners that align to that vision, want to innovate with you, and want to find ways to kind of create value together? And I do think that leads you to, Eric, kind of something we've talked about, I believe, on a prior podcast, which is that in healthcare, we did kind of go through, and you, Eric, were at the center of this, kind of a digital health explosion of lots of different solutions everywhere. And that actually was too much partnering. I think what we're seeing from the organizations we work with is that there's too many solutions on the shelf. There's too many disparate partners. They don't all work together. They don't talk together. It's unwieldy. So I do believe we're going into a world where organizations have less partners that are deeper, not more, that are broader. And they're thinking differently about how to collaborate with those partners. Because I think as a product company like League, as a healthcare payer like Highmark, or a healthcare delivery organization like Ovatient, we all have unique capabilities that we bring to the table, but we all don't know the answer independent of one another. We actually have to go solve these really hard clinical and care problems together. So I'll pause there.
Great answer, and yeah, I think it's a really great opportunity to be in this industry right now, because I think we could really put a mark on it. And to that end, I'm going to bring back Michael Dalton. He's the CEO of Ovatient, and currently in my former sort of space of virtual first, or care anywhere, we'll call it. And so, Michael, how is AI being used to both, as Charles said a while ago, simplify, and how are you using it and seeing it being used so members can get more engaged and more participatory in their own healthcare and overcome a lot of what maybe is confusion and complexity that faces all of us now within the healthcare system?
Yeah, this has never been more important for our health system customers. It's around benefit clarity, eligibility clarity. I mean, we're really talking about this from the context or the lens oftentimes of where there's, I think, a benefit for payers and their members and where they transition to being a patient. So in my mind, benefit clarity is part of care quality. If you don't understand your benefits, if you're losing your benefits, or you don't understand that a redetermination and you may have never experienced that is coming up, that is going to be a barrier to care. So also at the time and at the point of being able to get that care, and oftentimes that happens, especially in this virtual environment where we're providing those services, that's happening where there isn't, a quote unquote agent or, front desk staff member that's able there to help you. And I would say it's not always a bright spot. But we're solving for it is that, at the point of check-in or being able to make a scheduled appointment, that patients can understand what's covered, what's not covered, and what options they have. So I think really being able to personalize that is a great opportunity. And what I mentioned as well is that, building on the concept of a digital health home, having that one trusted place where a patient can go. And there's this, I really don't like the notion of a digital front door. But what I would say is benefits and coverage. I'd love people to take this away. Understanding your benefits and coverage, it's basically the front porch. You can't even get to the front door if you don't understand from a digital front porch, what is it that's covered? How do I navigate this? And what are going to be my costs? Because healthcare costs are going up for patients, for employers, for everything is going up. So we're partnering with League, and we're excited about some of the capabilities that are coming out from Epic as well. But we're partnering with League specifically and their agentic AI capabilities on our My Care Anywhere platform to turn on capabilities that will help patients understand what's covered, get plain language questions or answers to their questions. Do I qualify? What would the cost be? What do I do next? And then take action. So, I think that we all benefit when our patients and our members remain covered. And there's a great opportunity for us to work together to achieve this. So right now, and this is kind of where, Andrew and I think the team had talked about it here, is we're providing personalized context-aware content, and we're using data from the EMR. We're utilizing from our My Care Anywhere platform to provide guidance around care and some of the coverage decisions that they might need, so that it is personal. But Epic likes to talk about care everywhere or something for everyone. We really need to move, and this is where I think there's an opportunity, is benefits explanations for everyone. Because so many people that are super intelligent come to me and they don't understand their benefits. So medical doctors, PhDs, they struggle with understanding what is covered. And so I think really using that agentic AI to help guide them through that process and provide an actionable experience is something that I think will increase enablement, not just engagement, but enablement with their experience and their healthcare.
I love it. Now I got a new term I'm going to steal from your front porch.
Yeah, I know.
And it's perfectly in line with what Charles talked about earlier. So I love doubling down on that. And I'm getting all kinds of good jargon here from you guys. I want to close things out. I'm going to bring on Ian and Andrew to try to give me a couple of minute answers. I have 4 minutes for the two of you, but I want to ask you both. We got all these developments in AI. It's so fast and furious. I bet most people listening didn't even use ChatGPT a year ago. So over the next 6 months in the future, what are you most excited about? And how do you see it impacting everything that we talked about today? I'll let Ian go first, and then we'll let Andrew close it up.
So it's an exciting time. There's just so much going on. So I think we talked a bit already about how to increase the level of personalization. Put a bit in the Q&A about how we can tailor specific messaging and boost health literacy by talking to the member in the way that they want to be heard. There's already examples where we're able to translate benefit books into far more languages than we could ever think of doing before we had this technology. And again, if you're reading it in your own language, far more likely to use it and engage. And I think over the next immediate 2 or 3 years, we're actually going to see a lot of the benefit in accelerating and improving the administrative processes around healthcare. So maybe stuff that's not quite so obvious to the members and the patients, but hopefully they'll just notice things getting that bit slicker, a bit more like that consumer experience that we all complain that healthcare really lacks. And then I think looking a bit further afield, I think there's huge potential in the way we are able to use AI now to combine the entire body of medical literature and clinical best practice with the structured database of what's actually happening to these members. So we can do real world evidence techniques. We can understand how well that member is being guided through the best practice care pathway. And we can even project forward, which would be the most effective care pathway to get the best results for that member and patient in the future as they manage their condition. I think there's lots of really exciting things, but for sure, the next couple of years will be those relatively safer, quick wins around administrative processes and personalization.
Andrew.
Eric, what's top of mind for me is that this is a moment for new winners to emerge. It's that big. And so when you think about the next 3 years, this is a transformative inflection point for who really changes the model of care, who actually delivers on personalization at massive scale, who changes the workflows with the consumer, with the patient, with the member at the center, and who gives clinicians the ability to amplify the amount of care that they can deliver. And I 100% agree with Ian. There's massive opportunity to go and kind of automate kind of core customer experience processes. There's an even bigger opportunity to think about how does this new agentic technology make it easier to build trust with members and patients, and to take what is really complex and time consuming in understanding what to do about your health in making it super easy that it's motivational to actually take action. And to just make that personal, I'm going through a healthcare issue. I've been using ChatGPT. It's taken what would be hours of work in 2 seconds and given me an action plan. And now I'm taking action. And the barrier to me in taking action is how much time it can take to get started. If you can remove the barrier to getting started, now we can actually get people to take action. And so that simplicity of highly complex care recommendations and insights is so massively valuable. I'm just excited to see what the people here that we're spending time with, the people listening in, are going to go do with what's now at our fingertips.
I could not agree more. If we had more time, I'd jump on that example because I have one too. This was great. And I want to thank you all for not only the time preparing, but also for the time today, because this was a great conversation. I apologize to our audience for not taking questions from the Q&A module live. We were tight on time, even had to squeeze out a couple of questions. So on me that we went a little bit long. But I want to thank you all for just a great job. Thank you to our producer, Jessica Tenzer, who did a lot of this while away in the UK. So appreciate all that. And for all of you who are listening on a podcast, watching right now on Zoom, we do not take the time you spend with us for granted. We work really hard to create a show that you use the bright spots and the idea is shared today to inspire your thinking and enhance your organization's current approach to improving healthcare for all of us. We produce this show for you. Remember, this is your Bright Spots in Healthcare podcast. Thank you and take care, everyone.